Hello, everyone. In this podcast, we will be discussing sensitive topics such as sexual assault. It's important to take care of yourself while listening. Some suggestions are listening while you're in a healthy headspace or knowing who you can reach out to if you become upset. Our 24/7 helpline for crisis calls based out of Central Florida is 407-500-HEAL. By contacting the national hotline at 1-800-656-4673, you can get support and learn about your local resources. There's always someone ready to help. Welcome to the Victim Service Center podcast. Here we sit down with professionals that serve survivors and victims of trauma or those who have experienced violence and have conversations about social issues. This week, we are talking about coping with COVID-19. My name is Emily Mitchell, and I am the Education Coordinator at the Victim Service Center. With me today, I have Kris Albers. Kris is the director of the Sexual Assault Nurse Examiner Training and Sustainability Program with the Florida Council Against Sexual Violence. She is also an advanced practice registered nurse and a certified adult, adolescent sexual assault nurse examiner, conducting medical forensic exams in her hometown of Tallahassee, Florida. Balancing your life and work has always been important to her. She believes that if you do not take care of yourself, you cannot be there emotionally or physically for others. Kris, thank you so much for being here today.
You're welcome, and thank you for having me, Emily.
Yeah, of course. And I also have with me Emily Collins. Emily Collins uses she and her pronouns and is an LGBTQ plus victim advocate and crisis counselor in an adjunct position between two agencies here in Central Florida, the Victim Service Center and Zebra Coalition. Emily has experience working with trauma in various settings and currently specializes in working with the LGBTQ plus community after they experience sexual assault. Emily, thank you so much for being here as well.
Yeah, of course. I'm happy to be here.
Perfect. So as I'm sure, most people are aware, COVID-19 was named a global pandemic by the World Health Association on March 11th. Precautions have been put into place around the world, including the closing of schools and other businesses, setting of curfews, and of course, recommending social distancing measures. All of this has greatly impacted the daily routine of most people, if not all, including victims and survivors, as well as the professionals that provide essential services to them. In light of that, the main focus of today's podcast episode is in the midst of COVID-19, what are the main obstacles survivors are facing? And with that in mind, I wanted to go ahead and ask Kris specifically, as not only a director of SANE training and Florida with the Florida Council Against Sexual Violence, but also as a healthcare professional in general, what effects of COVID-19 have you seen?
Thank you, Emily. Let me start out by saying SANE stands for Sexual Assault Nurse Examiner, in case someone is not familiar with that term. Mm-hmm. And as the director of the SANE program and providing technical assistance to the 31 Certified Rape Crisis Center with the Florida Council Against Sexual Violence, what has occurred for us is we've had many, many questions from the rape crisis centers as to protocols and policies and how do they stay available for the victims of sexual violence, whether it be the medical forensic exams or advocacy or counseling services. And why this is so important is because victims come from all over, and in regards to it doesn't just happen to a certain set of folks. It can happen across gender, across race, across economic status, and no matter who it is, we as the Certified Rape Crisis Centers want to be sure that we are available. What we've seen is that sexual assault victims, our numbers have been decreasing in regards to showing up or entering into the system for a medical forensic exam. We have had to look at how we usually do things and what modifications we need to make in regards to the providing of care and being accessible. And I imagine Emily has experienced this as well as an advocate, and I'm sure she's going to speak to this as well. Fortunately, we have technology that has helped with this, but as someone that goes in as a healthcare professional and does a medical forensic exam, that's a one-on-one exam. And so we've had to put in place as to keeping the victim safe and having the examiner safe as well in regards to practicing using personal protective equipment, and prior to that, having screening questions to ensure that we're not putting either person at risk.
Got it. Yeah, thank you so much for sharing that. And yeah, I think, Emily, I believe the Victim Service Center is also doing new kind of pre-screening questions for intakes as well. So as an advocate, what was your daily routine like before COVID-19, and how has it kind of changed now?
Yeah, so this is always kind of a funny question to get when you're an advocate, and we get it all the time, is what's your typical day like? Because there really is no typical day for a victim advocate. So it's kind of this idea of have a plan of what that day is supposed to look like, but don't expect it to actually go like that. So it's always different because sometimes I'm working the hotline and answering hotline calls. Sometimes I'm responding to acute cases, which is what we call them acute cases when we go out to do the forensic collection of evidence. Sometimes we're going to court. Sometimes we're having crisis sessions in our office. And some of those things, like based off of the crisis situations that our survivors are dealing with, that might take precedence over something else that I had planned on doing that day. So as of right now, as you can imagine, there has been a spike in crisis for our clients. And it's this idea of, I need these services. How do I get them? Where do I go to get them? So right now, my typical day is just making sure that my clients know that they can still get in contact with us. We're still here, even though we're working remotely. So contacting them through email or phone calls instead of being able to meet with them in person. As far as the screening questions, yes, we are asking for the intake cases or for the acute cases as they come up. We're asking all of the screening questions as indicated by the CDC, and those are updating and changing as the CDC updates them. So right now, what's really key for us is keeping in close communication with the other advocates and the nurses that we work with and our supervisors and everything to see what's happening, because it's all changing minute by minute.
Got it. Yeah, it does feel like every hour there's a new update about COVID-19 and kind of different precautions and different measures that we should be taking. And I love that you said that the life of an advocate is there is kind of no daily routine, but I'm sure that COVID-19 has really been disruptive in that. And you're doing. If I understand, you're doing like telecommunication, right, with your clients now?
Right. So we've transitioned to like video and phone sessions with our clients. And so now we're all just figuring out how to navigate like the technology and all of that to make sure, because all of our sessions are of course confidential. So just figuring that out so that our clients feel as safe as possible. And we're in the very beginning stages of that right now.
Got it. And with Kris, what would you like to share to the community at large about this pandemic?
Well, I think what's so important about this is the heightened awareness of how the disease spreads. And it really takes us back to what public health really means. and is, which public health has been taken for granted for so many years, I think, just because we've never had this type of outbreak or pandemic ever. And it's public health is all about promoting healthy lifestyles and researching disease and injury prevention. And most importantly for now is detecting, preventing, and responding to infectious diseases. And so what's been so important with this pandemic and individuals recognizing what is necessary to not only prevent the spread, but to improve the health of the people and the communities as a whole, because that's where we're wanting to get back to. We want to get back to the health of people and the community so we can get back to what we knew as normal, which I think is going to be a new normal for everyone because of the heightened awareness. I think public health has been kind of taken for granted because, number one, as I mentioned, we've never had something like this, and because our healthcare workers, our scientists, our government officials have done exactly what they've always should have done and do. But what the message is here is that they're not going to be successful in this type of situation unless each one of us does our part and follows the directions that are given to us.
Got it. Okay, perfect. Yeah, thank you so much for shedding light on that. And Emily, I also wanted to talk to you about kind of specifically how COVID-19 has affected survivors. And I do know that you do a lot of work with the LGBTQ plus community. So I was hoping that you could also even talk about that community specifically and how COVID has affected them as well.
Yeah, of course. So it's really unique, and we're learning more every day about how this is affecting our survivors. Of course, we knew when everything started to shut down, people were asked to stay home, practice social distancing. We knew that that could have effects on our clients. And each day we're learning how those effects are being added to. So, of course, we always, when people are at home more often, we have to think about like our domestic abuse survivors, or people who are experiencing intimate partner violence and potentially being in a place where they might be stuck with their perpetrator for longer periods of time. There are different things popping up every day. I know, Kris, that you mentioned there have been less cases generally of forensic exams since this started. And while we have seen a little bit less cases, we have seen an increase in the last week in cases related to intimate partner violence. So that is something that we are concerned about. Let's see, I took a lot of notes in preparation for all of this because I talked to some of the other advocates as well to see their experiences working on our hotline. We have had an increase in hotline calls, and it's a lot of people who are calling to see where they can get the services that they need, where they can get the resources that they need as places are closing. We also reach a lot of our clients through outreaches, and that's how a lot of people find out about the services that we have. And we're not able to do those outreach services right now. So we're having to really get creative and figuring out how to reach our survivors so that they know that we're still here. And just different worries, like a lot of our clients are already in very stressful financial situations. So they may have lost their jobs or have like families that have lost their jobs. So there's also a lack of shelters right now. Whenever there's a crisis like this, the shelters tend to fill up very quickly. So when people are coming out of those intimate partner situations looking for shelters, we're concerned that it might be harder to help them find those. So that's another thing that we're monitoring as closely as we can. As far as how it's affected the LGBTQ plus community, we have, of course, all of those same concerns that I've already mentioned, and then it's just kind of like an extra layer. So the whole reason that my job exists as being an advocate that specializes in working with the LGBTQ community is because we know that the experience being a survivor of sexual assault or any type of trauma is already layered and difficult and can be like frustrating and emotional. And when you're also LGBTQ, it just adds in it a whole nother layer to that. So what I'm hearing a lot of right now is that this mass crisis that really the entire world is experiencing is a lot of people are experiencing like reminiscent feelings of things that they've been through in the past. So some examples of that, like here in Orlando, I'm hearing a lot about Pulse right now, and a time like this where everyone is, you almost feel more connected to some of the people around you because of like the support and stuff that you're getting, but it still is like such an emotional, hard thing that you're going through. So I'm hearing that it's very similar to that time. I'm also hearing a lot about the AIDS and HIV crisis and how this mass pandemic and seeing it on the news constantly, it's so reminiscent for the people who were affected by the AIDS crisis, but it's a little bit different because they're seeing the entire world come out in support of the people who have tested positive for COVID-19, whereas that wasn't the case during the HIV crisis. You didn't really see that support.
Oh, I didn't even think of that. Wow, that's so true.
Yeah, that's something I'm starting to hear a lot more about as we see more of this on the news. Mm-hmm. And then, of course, you have to worry about people who are quarantined with unsupportive families. Maybe you're not out families, so you have to like work extra hard to hide who you are. Then also we have a lot of gig workers within the LGBTQ community. So that would be like DJs, drag queens, people who really survive off of the funding or the money from being able to go to clubs and bars and stuff, and they're not able to do that right now. Another thing to think about is really the trans community and the disproportionate effects that something like this can have on trans folks and their ability to get access to safe hormones. I've also seen that, we're in deciding like what's considered emergency surgery and what's not. A lot of gender confirming surgeries are starting to be pushed back now, and to like, we don't even know when, because no one knows when everything's going to be back up and running again. So I mean, people wait years or even their entire lives for some of those surgeries, and it's got to be just devastating to be so close and then have it be pushed back.
Yeah, and I didn't even think of that, where there's been this kind of interesting thing going on where people are deciding what is essential and what isn't. And I assume that it would be really triggering to hear that a gender confirming surgery would not be seen as an essential form of care. I didn't even think of that.
Yeah, absolutely. It's got to be really hard for the people that are experiencing that. There's also, of course, higher rates of homelessness within the LGBTQ community. And one thing that when I started this job about a year and a half ago, I knew from like doing all of the research and stuff how the LGBTQ community experiences sexual assault and trauma in different ways. And I knew also that the LGBTQ community had experienced higher rates of suicidal thoughts and even like suicidal attempts. But it wasn't until I started my job and started working with my survivors that I really realized how prevalent it was. And this is now something that I talk about with my clients daily. So that's definitely something that I'm concerned about. I've read a couple articles from like different police jurisdictions saying that they have gotten more calls for suicide attempts in the last few weeks. So that is another thing that I'm concerned about, because this feels so overwhelming and you might feel like in being isolated, like you don't have that support. So it's really just important for people to know that we're still here and that they can still reach out for that support when they need it.
Yeah, absolutely. Thank you so much for shedding so much light onto that, and bringing in that other perspective. I didn't even think of, the AIDS crisis at all. And And I've been talking to, people in my life about, this pandemic that's going on, and, people who have been here longer than I have. I'm only, 26. And I was like, is there anything, that's happened like this before? And they've had a hard time kind of comparing that. So I kind of wanted to ask you, Kris, as like a healthcare professional, is there, I think I kind of already know the answer, but is there something, similar that's happened in the past that you can remember that is, similar to what's happening now? And in general, if you have any like tips to share about how to cope with the pandemic that's going on.
Right. As Emily was talking, and there's several things that resonated with me. I too thought about the HIV and AIDS epidemic and how fearful everyone was, and the communication to the public. And it was a really scary time for many individuals. And so that reflection for many can certainly increase fears and stress and anxiety at this point in time. In 2009, there was the H1N1 influenza, if you remember. And so at that time, I was not working at Florida Council Against Sexual Violence. I was working at the Florida Department of Health, and I was working in emergency preparedness at the time. And I was working closely with a hospital liaison that worked at the Florida Hospital Association, but worked with all the hospitals across the state. And it was our job to talk about how, as a state, as hospitals would be prepared for if this became a pandemic, the H1N1. And there were a lot of discussions about respirators. So this was, when this came about, I could not help but reflect back on those days and how concerned we were, and what preparations needed to be taken, and what the thought process was going to be if we were short on respirators. So that's the only other time that I recall in my lifetime that there was a very much a concern. Fortunately, it never reached to the point of a pandemic. We certainly lost, but it wasn't what we're experiencing now. And I think the majority of people would say that they never, ever expected to see this in their lifetime. And so from a public health perspective and from a mental health perspective, I was happy to hear Emily speak to that in regards to mental health. There in the community of healthcare professionals, whether it be advocates, mental health counselors, whether it be, psychiatrists, psychologists, nurses, we are concerned about the mental health of individuals that because of the isolation and not being able to reach out and be with others. And being with others is so important in our life. And that's been taken away from us. So that's why the technology of telehealth and video conferencing, as Emily mentioned, is so very important. And Emily also mentioned about stress and how violence escalates. And that too is why the centers, the rape crisis centers across the state, are very concerned and want to, and working towards altering how they do connect with clients, whether they're current clients or whether they're past clients, or whether they're new clients. It's just that need to be able to talk and be supported. So it's a scary time. But I do feel as though, if we continue to work towards the end, which is taking care of those that are sick and most importantly, preventing continued spread, that we will overcome this.
Yeah, absolutely. Yeah, thank you for shedding light on that and sharing, more of the healthcare side, but also the importance of the mental health side as well. I do know that, yeah, we have been getting more, domestic violence rates do go up. I do know the isolation, we are concerned about our clients with suicidal ideation. It's interesting because it feels like we're isolated, of course, but also that people who I haven't really talked to in a while are reaching out to me, and vice versa. So it's an interesting, like, coming together, but also in isolation, which is kind of an interesting thought. And Emily, I know that you've been posting a lot of self-care tips on our Facebook and Instagram page recently, which are great. Thank you so much. What tips do you have to share for those experiencing that anxiety and depression and social isolation that you were mentioning?
So self-care is definitely always important. And during something like this, I know personally my entire self-care routine is completely out the window,
Right.
Because everything that I usually do, I don't have access to. I can't go to the gym like I used to. I can't go hang out with my friends like I used to. And so it's really just remembering that self-care is very self-specific. There's a lot. One of the reasons that we're posting self-care tips on our social media pages is just to remind people of the options that they have. And so it's important to know some different options. There's lots of self-care tips floating around on social media right now. As I'm scrolling through any of my social media outlets, I'm seeing tons of different suggestions. It's always good to have those reminders because sometimes you may not be thinking about what to do. You see something new, or it reminds you of something that used to work for you that you could try while you're at home. But it's also important to remember we are human beings, not human doings. A lot of these self-care tips are saying, organize your closet, do a workout at home, pick up on that spring cleaning, go ahead and do it now. And while those are great suggestions, that might not be what you feel like doing right now. So when it comes to self-care, you really have to check in with yourself and think, what do I feel like doing today? What is going to help me feel better right now? If that's taking a nap or laying on your couch and binge watching Netflix, if you're able to do that, then do that. It's really specific to what you need at that moment. And definitely taking breaks from the news and social media. It's important to be connected and updated on what's going on in this chaotic world around us. But it's also good to take breaks from that because it can be really overwhelming to see that constantly.
Yeah, absolutely. I love that you said that we're human beings and not human doings. I think all of us have felt this maybe pressure to be productive during this, which might not be very helpful.
Exactly.
Right. I'm not sure. I don't know if anyone else has been feeling that way, but yeah, I've been feeling like I have to be productive for some reason. So just kind of knowing what works for you and understanding that, yeah, this is not a normal time. So doing anything that makes you feel a little bit of normalcy, you should definitely do. Thanks for sharing that. And Kris, I see that you served as a public health administrator for over 12 years. What lasting effects, I know it's kind of hard to look into the future now, but what lasting effects do you think COVID-19 will have on public policy? I think you went over a little bit, but if you can share a little bit more, that would be great.
Well, I think that this COVID-19 pandemic really highlights the importance of our public health systems and the importance of adequate funding. And it's not that funding is the be all and end all, but it certainly is important. As we have seen with this pandemic, there on the news that there is a shortage of PPE, personal protective equipment, there's a shortage of respirators for the patients that come in that are sick. And I think that this is something that policymakers are going to need to address for future outbreaks to keep this from happening again in regards to a pandemic. Maybe also the quicker containment response may be a solution in the future. There is a lot of value to when you speak to public health and the spread of diseases. There's a lot of value to containment, which we have done, but I think that maybe from a state level, local level, that maybe there will be a quicker containment response or directive, if you will, like the stay-at-home orders or crossing the borders. So I think there's a lot of opportunity to learn, and I know that that's exactly what's going to happen when everything settles down, is that there's going to be a review of how the response was handled and what changes can be made. And I do believe that funding is going to come up, and I do believe that it is important that everyone looks back, even from a personal perspective, as to what they can do on an individual level. It's interesting, about the hand washing. That seems so basic, and it is. But how that has had to come back to light as to how important it is. I think over the years we've all become, not some people, but all people possibly have gotten a little lax at the hand washing. And I think vaccines are going to be stressed even more than they are today. There were diseases that were essentially eradicated, like measles was eradicated at one time. And the reason that was eradicated was because there were vaccines were promoted and required for school entry. Now there is currently a movement for some to not have vaccines administered to their children. And so we've seen a little bit of a reemergence, but nothing significant at this time. So I think vaccines are going to be discussed as well.
Yeah, absolutely. That makes complete sense. And on the advocacy side, Emily, do you think that this pandemic will affect the future of advocacy in general?
So I think it's just important to recognize that this is a trauma that the entire world is experiencing. And one thing that makes trauma so hard is that it's something that we don't have control over. And we know there's a lot of grief and loss and just sadness and anxiety and all different kinds of emotions connected to something like that. So it's the effects of this trauma, as we know trauma does, can linger. And I think that it will just it's something that we're going to have to adapt to as time goes on. At this point, we don't even know how long it's going to last. We don't know how long our lives are going to be disrupted and court systems are going to be closed. So we're just going to have to adapt as things get back up and running, once they do get back up and running, and just kind of be there and stay with our clients the way that we always do, and hope that people know that it's okay that this affects you for years. I think especially with those financial burdens and financial issues that we deal with a lot as advocates that we help our clients through, we don't know what the economy is going to be like on the other side of this. So it'll just take time, and all of us just kind of adapting to the world around us as this continues to figure out what the lasting effects really will be.
Absolutely. Thank you so much, both of you, for sharing your perspectives and your professional expertise in both of your fields. Is there anything before we kind of sign off here that you'd like to add about, this topic or in general about sexual assault in our community?
I think I'd like to reiterate what Emily has spoken to in regards to there still is assistance or help there for individuals that are in need of assistance and the ability to talk to a advocate or a counselor, that not to hesitate to call if they are experiencing a re-traumatization because of this pandemic or a current trauma of this pandemic, that they're still only a phone call away and that they can certainly pick up the phone and someone will be there for them. I think that's extremely important.
Yeah, absolutely. I know that, definitely the Victim Service Center is still open. Like Emily mentioned, we have that 24-hour crisis hotline. It'll always be answered by a master level, crisis advocate, ready there to assist. And of course, forensic exams are still happening and someone's always here to help. Anything else you'd like to add?
I have a couple more resources that I just wanted to mention. Definitely calling our hotline number. A lot of support groups and stuff, I know that's been another concern for a lot of my clients, is they really rely on the interactions in those support groups. So while our support groups are not virtual right now, are a lot of things like support systems and stuff out there that are going virtual. So reach out to us. We can help you get in touch with any of those services if that's something that you're interested in. And then as far as there's tons of hotline numbers. We can also help you there's crisis texting numbers and stuff like that. If you call our hotline number, we can give you the information for any of those that might be specific to you. And as far as for the LGBTQ community, there's a website. It's them.us, so them.us. And I was looking at it this morning, and they have some really great resources on navigating through COVID-19 as a member of the LGBTQ community. So I definitely would suggest reaching out to that. They even have lists of movies and shows that you can access and how you can access them to help you through different feelings and emotions and stuff that might be coming up right now.
That's perfect. Thank you so much for both you and Kris. Thank you so much for joining us today. And for the listener, thank you for listening to the Victim Service Center podcast. The VSC is a nonprofit organization that provides free confidential counseling services for victims of any kind of trauma in Central Florida. To learn more about our services, please visit victimservicecenter.org. And to everyone listening, healing is not linear. You are not alone. And thank you again for listening, and take care, everyone. And thank you, Kris and Emily, once again for joining us today.
Absolutely.
Yeah, thank you.
And thank you.